The KneeKG is a marker attachment system that allows us to track the movement of the tibia, so the bone of the shank, in regards to the movement of the femur, the bone of the thigh. And while the patient is walking, so in a functional task, we're able to quantify and look what's happening in 3D of the movement of the tibia in regards to the femur. So therefore, we're able to know and measure if there's any impairments in these small movements that can be linked to the progression and the development of different pathologies of the knee joint. Therefore, it helps the doctors to really personalize the treatment plan, tailor the treatment plan to afterwards, once treatment is done, we're able to reassess the knee joint with the KneeKG and superimpose the curves and really look if the treatment was effective or not, and then remodel the treatment plan if required, and therefore helping more specifically the patient. So once the exam is done, the software allowed us to look at the data instantaneously. And for the doctor, we're able to simply generate a report pretty quickly and to pinpoint and highlight everything that is positive, so what's going wrong with the knee, and have a full explanation of all the three movements at the knee joint.
The KneeKG in my practice is definitely a functional tool that has been brought to us to help the process of evaluating and following either injury or state of the knee that can be, for example, the osteoarthritis, which is definitely a problem to treat and to follow. So with this new way of examining a functional knee, it's definitely a process that is going to be helping my colleague doctors, and I also believe that it's a very, very helpful tool to help evaluating patients for the physiotherapist, as well as following their treatment, evaluating and following their treatment.
The KneeKG is a clinical tool that helps clinicians diagnose more accurately. It is probably the only medical device available that allows us to analyze the knee dynamically. There are several other benefits to use the KneeKG. It's also very useful for therapy monitoring. In other words, the patient undergoes a KneeKG exam, the patient then follows a treatment plan, and later, when we reassess them with the KneeKG, it immediately gives us objective information about the efficacy of their treatment on the knee function and tells us how the patient is coming along. For me, as an orthopedic surgeon, it's a very useful clinical tool because I treat patients, and with the current investigation techniques, such as MRI, there is a trend to treat according to images. The KneeKG allows us to better treat the function of the knee, and as an orthopedic surgeon, this is my objective.